A new program in the Sacramento region is helping identify and treat mental health challenges among pregnant and new moms before they become crises. Dignity Health has launched a maternal mental health community health worker pilot program, and it's happening right now at clinics in Woodland and Midtown Sacramento. This morning, we welcome Dr. Deanna Dawson, an OBGYN with Dignity Health Mercy Medical Group, as well as Beatrice Vasquez. She's a community health worker, also with Dignity Health Mercy Medical Group. Thank you both for being here so much. We appreciate it.
Thank you.
Thanks for having us.
Why is maternal mental health so important right now? Either one of you can jump in.
I can take that. We know that one in 5 women experience mental health conditions during pregnancy and postpartum, and much like mental health outside of pregnancy, there's a lot of stigma and lack of support, but we see rising rates, so it's important to support mothers and intervene before it becomes a crisis.
Let's talk about this program specifically. What makes it different from traditional pre- and postnatal care?
Sure. So we're really targeting and screening earlier and more frequently than typical in most practice settings, again, so we can capture a crisis before it happens.
And how do you measure success? I know it's a pilot right now, but kind of what's the metric that you're using?
So really intervention and who's getting access to support has been one of the primary metrics.
Beatrice, let's talk a little bit about the community support. How does that play into this pilot program, and how ultimately does it work?
So what we're doing right now is screening throughout different touch points in pregnancy, and so we're able to identify risk factors or those moms who are at risk of developing postpartum depression or anxiety, which is actually very common. And so we connect moms to community resources, support groups, and behavioral health if that's something that they are needing, and it's very personalized.
Sure. And you talk about the screening, so is it just a matter of like interviewing these moms and kind of talking to them?
So there are screenings that, there are mental health screenings that they see throughout pregnancy, so it's 3 through pregnancy and 2 in postpartum, and so that's how we're able to capture some more of the moms who are at risk of developing postpartum depression and anxiety.
Let's talk about some of the early results of the pilot, right? So it started last year, October of 2025. How significant are these findings?
It's been quite significant. So we mentioned the prevalence kind of in the general population of seeing 1 in 5 people having postpartum or pregnancy mental health conditions, but we're seeing 1 in 4 in our community. And of those people screening, 100% are getting an intervention of some sort. So there's been a significant impact at this point.
All right, really quickly, my producer's telling me to wrap up, but we want to just give moms some advice. What would you say, and what would you tell women who are watching this morning about what they need to do as it relates to their mental health?
Sure. Well, firstly, that women are not alone, that this is a very common condition. And despite the stigma, many people are experiencing it, so don't be embarrassed or ashamed to reach out to your obstetric care provider if you need help, and don't wait until it's a crisis.
Okay. Thank you both for being with us this morning. We appreciate it.
Thanks for having me.